Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada, and my co-host today is Kenyatta DeBiase, Operations Administrator, and we are reporting for the week of November 9th, 2020. As health professionals rooted in Oakland, serving some of the people most likely to get and suffer from COVID-19, we are here to cut through the noise and give you the information you can use to keep yourself, your family, and your community as safe as possible. The goal of the People's Health Briefing is to give you our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email at admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we are here to give you information as it relates to Oakland and East Oakland in particular. Alameda County now has 24,851 coronavirus cases and 475 deaths. Positivity rates are slowly coming down overall. The county positivity rate is now at 3.7%. Oakland makes up about a quarter of the population of Alameda County, but still represents close to 40% of the positive cases. And unfortunately, nothing has changed in terms of the top 3 zip codes in the county for both COVID case rates and COVID positivity rates. The top 3 zip codes remain 94601, 94603, and 94621, all in East Oakland. These zip codes make up about 1/3 of the population of Oakland, but make up about 60% of COVID-19 cases. Now, I want to talk about COVID-19 symptoms and what we have been seeing among those who have tested positive so far. So far, Roots Community Health Center has 1,420 patients who have tested positive in Oakland. Only about half of those who tested positive reported having symptoms at the time of testing. But once we spoke with them, about 78% reported having had symptoms within the preceding month before they got tested. So out of the 1,420 patients who tested positive, 48% had no symptoms, 25% had cough, 22% had fever, chills, or sweats, and 12% had sore throat. Less frequent symptoms included diarrhea, vomiting, shortness of breath, and body aches. Out of those who had symptoms, 1 in 5, or about 20%, had a loss of taste and or smell. This is a symptom that is quite unique to COVID-19. Out of those who had symptoms, 34% stopped working within the first 2 days of getting their symptoms and 44% within the first 5 days. That's a number of people who continued to work with symptoms. So of course, we would like to see this get to 100% stopping working on day 1 of symptoms. Please, the day you get symptoms, don't go to work. Go get tested, isolate, and wait for your results and further instructions. Now, of those who had symptoms, 32% got tested within the first 2 days of getting symptoms, and 58% got tested within the first 5 days. Again, we like to see this happen immediately. If you believe you were exposed, please get tested right away. If you have symptoms, please get tested right away and isolate, wait for your results and further instructions. Children under 14 years of age were the most likely group not to have symptoms at all. In fact, 66% did not have symptoms at the time of testing, and 53% did not have symptoms at all within the month preceding their test. So while 78% of those testing positive overall had symptoms within the month preceding their test, only 47% of children under 14 years old did. This is something to be mindful of, particularly as sports and schools reopen, as we know that COVID-19 can be spread even by those without symptoms. Now, we know that we're heading into flu season, and flu symptoms also include fever, cough, body aches, and sometimes vomiting and diarrhea. So it can be impossible to tell the difference between COVID-19 and the flu without testing for both. This is one big reason why everyone should get the flu vaccine starting now. If you get the flu vaccine, then if you do get sick with symptoms, at least you'll be reasonably sure it's not the flu. But the main reason you get the flu is to prevent serious illness, hospitalization, to make sure that you don't get pneumonia that could take you to the hospital or could even be fatal. The main objection we hear to getting the flu vaccine is that people believe that they are receiving the flu when they get the shot. That's just not true. When you get the flu vaccine, it can give you mild symptoms, but it can't give you the flu because it does not contain the whole or live virus that causes flu. The injection contains either a killed and completely deactivated virus, or it only contains a single protein from the virus so that it is not infectious at all. But it triggers a response from your immune system so that your body can then be prepared to fight it if you get exposed to the real thing. Rarely we do hear of someone who feels pretty bad after getting the vaccine, but it's still mild compared to if they would have actually gotten the flu. Now, the nasal spray vaccine is a bit different. It contains live viruses that are attenuated or weakened so as not to cause illness. So for that reason, the nasal spray flu vaccine is only approved for use in healthy, non-pregnant individuals aged 2 to 49 years old. People with certain medical conditions like diabetes or a weakened immune system should not receive the nasal spray flu vaccine at all. So we primarily administer the injection, which again contains a killed and deactivated virus or only a single protein from the virus that is not infectious. The other objection we hear is that the flu shot isn't even effective. Well, it is true that the flu vaccine is nowhere near perfect. There's a lot of work that goes on all over the world into figuring out which strain of the flu we are working with each year and trying to ensure that the flu shot is effective. The flu mutates a lot, which is why each year it's a different vaccine. Some years they do a great job at predicting, and other years not so much. But on average, the flu shot has a 40 to 60% chance of being the precise match to the flu strains circulating that year. But even when the match isn't perfect, there's plenty of evidence that getting the flu shot will reduce your chance of being hospitalized or going to the ICU with the flu. So getting the vaccine, even if it isn't perfect, makes for a milder illness if you do catch it. And even when the vaccine isn't perfect, it prevents millions of cases and thousands of deaths each year in the United States alone. And now there is yet another reason to get the flu vaccine. A recent study published in the Journal of the American Board of Family Medicine looked at the medical records of 2,005 people who had received a flu shot in the last year and then were diagnosed with COVID-19. The researchers found that people who had been vaccinated for the flu were over 2 times less likely to be hospitalized for COVID-19 and more than 3 times less likely to be admitted to an ICU. And although this study didn't look at cause and effect because it was looking back at medical records, there is evidence in the literature to point to why this might happen. The flu vaccine activates cells in our immune system called natural killer cells, and it's possible that natural killer cells that were activated is what helped the body fight COVID-19 more effectively in the 2005 patients reviewed in this study. And last but not least, there is evidence to suggest that you can get both COVID-19 and the flu at the same time. And we believe that this could be particularly dangerous. So everyone 6 months and older should get the flu vaccine, and there are a number of places where it will be given for free. You can call your primary care provider to schedule an appointment for the flu vaccine, or you can go to one of the many flu shot events happening in multiple locations over the coming weeks and months. Roots Community Health Center is hosting flu vaccine events right here at 7272 MacArthur Boulevard in Oakland over the next 6 weeks in partnership with Anthem Blue Cross, and we will be adding more locations and more dates in the weeks to come. So please check our website at rootsclinic.org and our social media at Roots Empowers for more information. And now let's hear from my co-host Kenyatta DiBiase on his experience with the flu shot.
Hi, how you doing? My name is Kenyatta DiBiase and I work here at Roots Community Health Center. This year I chose to get a flu shot for the first time as an adult because I didn't want to take any more risks than I needed to with COVID. Another one of my real large concerns for getting the flu shot this year is that I did not want to infect any of the people that I regularly go see. I have a very small group of people that I decided are safe to be around during these COVID times, and by taking my flu shot, I lower their risk and my own risk. By getting a flu shot, I'm controlling the risks that I take. I think that it's important for everyone to realize that if you get the flu and COVID at the same time, you're going to be complicating the risks that already exist, and you'll probably end up in the hospital, and I don't think that's a good idea. My experience was really pleasant. I went up, I signed up for free. I didn't have to give them any of my medical information or anything like that. I sat down, rolled up my shirt, and I was given a shot. It was really quite pleasant. It didn't hurt at all. It's been 3 days since I got my shot, and the only thing I've really suffered is a little bit of a sore arm, and taking off the Band-Aid hurt a little bit. But other than that, it was absolutely fantastic. I'm really suggesting that you guys go out and get your flu shot. I think it's really worth it in these hard times right now. Thank you guys so much for listening, and now back to the good doctor.
Oakland, I'm not gonna lie to you. I never get the flu shot. I know I'm probably not supposed to say that because I am a healthcare professional, but this year is the first year as an adult that I got the flu shot. And I did it for a number of the reasons that I've already stated here in this briefing. First of all, if I do come down with symptoms, I do not want to be worried about going to get tested for the flu and for COVID to try to sort out what's going on. That's just too much extra to be thinking about. I would like to be reassured that I have protected myself to the best of my ability against the things I can protect myself against, which are influenza A and B. Unfortunately, COVID-19 doesn't have a vaccine out yet, but at least I can be assured that if I start to get some symptoms like a cough or a fever, I can just go and get my COVID-19 test, isolate, and wait. Also, I do not want to have to think about the notion of getting the flu and COVID at the same time. That sounds terrifying. I'd like to just put that option out of my mind. And lastly, even though I normally don't get the flu shot because I'm taking a calculated risk that I'm not in the high risk category, and so I'll just take a chance, this year I don't want to take a chance. The last place I'd like to be right now is in the hospital with other people who have COVID, and with a potential new spike in cases coming, we could have crowded hospitals with people with all kinds of infectious diseases, not least of which is COVID-19. So it's not the place to be. So this year, I'm protecting myself, and I really hope that you do the same. That concludes today's People's Health Briefing. Please tune in next Tuesday at 10 a.m. and we look forward to seeing you then.